Hello, everybody. Welcome to Aware and Care, your weekly program with Dr. Ambika Nair, co-founder and chief consultant at Santhigram Group of Companies. In the series on depression, we have covered a couple of episodes, and there's so much more to delve and understand with Dr. Nair. She's kind enough to explain to us patiently about what these different types of depression are and how Ayurveda can help us lead a healthy life, body as well as through mind. Today, we will understand with Dr. Nair what is Pitta-related depression. For that, first, we need to welcome her. Namaskaram, Doctor.
Namaskaram, Madhavi.
Dr. Nair, this has been a very helpful series with the messages and emails and texts that we are receiving. We are so thankful for this opportunity that you have provided us to talk to people and help them understand that there are many conditions out there that are manageable and curable. Today, in the condition called Pitta-related depression, let us please understand, please explain to us what it is. Is it metabolism or is it food-related, or it is considered, there's a myth that it is one of the most difficult types of depression. True or false? The mic is yours.
I will explain.
Sure.
Actually, Pitta means that is comprising of fire and water. It is the, which oversees the knowledge, insight, connected with the, deep knowledge actually. Minute factor, it is connected with the minute factor of the cerebrum also and has a vital association with the brain.
Okay.
That's why, their cognitive power is very fast. They learn so many things in one go. So our Pitta is by and large connected with the boldness, very bold. No, they are very adventurous, certainty, self-control, knowledge is there, administrative power. Everybody cannot be the leader. You can see very few are the leaders. So these are Pitta people. They have feeling of vision. They oversees the things. They know that what they are doing. Acknowledgement. They are very happy. Fulfillment, energy, collaboration, ability to do the things, to give up also. So when they feel that it's not going to work, they will give up. They don't get depressed at that time. When Pitta is in balance. Yeah.
Oh, that's interesting.
And when they are not in balance, that very uneasy, they feel so jealousy, misery. They cannot, when other people will do, they cannot understand, Pitta imbalance is very dangerous also. That they cannot fulfill the responsibilities. They feel that they are useless, powerless. Since certain positions, especially in high positions, people will be working. Suddenly, they are demoted, their position goes away, that they are they're very good, then they feel like this, laziness.
Dr. Nair, you just mentioned a very important trait, that is jealousy. Jealousy by itself is such a dangerous tool that can lead to so many dangerous outcomes. Anger and anxiety, of course, all follow that. So that itself explains a lot about the quality or imbalance when somebody's facing this condition. Now, let us understand what are the symptoms for Pitta-related depression. Does that person try to show anger more, or somebody just hides too much? Or what happens to a Pitta-related depression? How do you actually define that? When you see a patient, you know that these are the symptoms.
Very disturbed mind. They cannot concentrate on anything actually. Very anxious, so fearful. What are this? Because they feel that they have committed some mistakes, loss of interest. They don't want to meet people. They like to be aloof from people, they cannot remember the things. They cannot even think that what they did the best. And they get when it can be with related with some thyroid issues also, or deep some people take a lot of medication for migraine, all those things, so it does not work, then this problem comes. And so many people come to us also by telling a whole body pain does not go. So this is all Pitta and Vata related. So Pitta, when out of, way it goes, maybe some eating habits, dietary, problems, sleep problems. Some people will not sleep for they say that I didn't sleep for years. Wow. They may be just taking a nap, you understand? So such cases, these all the things, they cannot concentrate. Their anger is uncontrollable anger, destructive mentality, all those things comes in that.
So Dr. Nair, So when somebody comes to you with this condition, Pitta imbalance, and there is also depression related to it, I know this is your line and you know it, the best of it. So are you first treating their anxiety? Are you first treating their insecurities? Are you first treating their depression? What is the point of attack or understanding the root problem? Because Ayurveda talks from the root problem, right? So which aspect of it is coming for?
Ayurveda has a holistic approach.
Right.
To offer any condition, especially mental condition. And mental health is really more important in us. If our mind is good only, then we'll be able to do something in our life, related with our intellectualism, then spiritualism, everything comes in that, whether our focus is there. So in these cases, we all, when we are born, we all have a blueprint actually.
True.
So, according to the constitution, that's why we always stress on this point, everybody differs. See, even if the finger in our hands are not the same. So everybody will have a different, constitution, like a combination. So we have to diagnose them very properly through the, like a Nadi Pariksha, what their constitution is. Sometimes they won't even sit over there. They will not believe anybody because they must be have taken, so many other medications and everything. What you will do? First session, they come and ask you this question only. So to pacify them, make them to sit in front of me. So we do this and, the problem can be like, will you be able to help me? Yes, definitely. We will be able to help you. We have an approach. We have a way of doing the things in the right way. We have a dietary, a way of giving, what they should eat, everything. Then, slowly they come to our, way and we start you ask me whether we treat with the anxiety. Anxiety is the basic actually. The mind goes out of way actually. So once they were, very intelligent, now they cannot even think of that. Fear, creeps in their mind and their confidence goes away. So insecurity feeling, fear of doing everything wrong. So this all comes.
Okay. Doctor, a very sensitive question. And of course, I want to assure all our viewers that any messages that are conveyed to us while in person or through emails are completely confidential. We do not take the names of any patients, nor there are any indications there. Dr. Nair, there have been a couple of questions from concerned viewers who wanted to check and understand. And I would suggest to our viewers, please go for a private consultation with Dr. Nair. It is much more comfortable for you to get the answers in person. Somebody asked a very beautiful question. They said there is a trait of depression, like you just mentioned about blueprint when we are born. Somebody in their family, their parents' side, they have depression. And this person is now in constant fear that he or she may get depression and follow the same traits, physical traits or harming nature of what those members in the family did. Now, how do you explain to somebody that this is individual case to case and the blueprint can be taken care of?
Because actually genetic factor is also more important actually. See the thyroid, like the mother had thyroid or father had thyroid, the son has thyroid. Sometimes it will be a hypothyroidism, which will lead to a hyperthyroidism in the child, you understand? So that the father may be perfect, son may not be perfect. They will not sleep like that. So it always affects the nervous system actually. So we explain them very nicely how it happened, why it happened.
Okay.
Then only we take them into confidence for the therapies.
Okay.
Yeah.
So this can be talked out, this can be treated, this can be cared for, and the effort of all the family members is also very important. Dr. Nair, what kind of skin conditions do people with Pitta imbalance, especially going through depression phase, do they have more dry skin or oily skin? And how is their appearance?
Dry skin will be there. Dry skin. Okay. Yeah. In the Ayurveda, what we, see, whether it is little kapha will be there, whether vata will be there or anything, let's say understanding the nature of the person, the constitution of the person and what they underwent, whether they have, some in the young children, what I have seen that, they are taken by their friends.
Yeah.
So in a wrong way, they don't use the, utilization of the mind in the proper way.
Okay.
So that responsibility, they will be living in the past by thinking that, oh, I should not have done that. They blame themselves, criticizing themselves. So Dr. So many cases comes to us. Yeah.
So I was just about to come to the same question. Do you see this a particular age group that is more affected by this, teenagers or women or old age? Anything specific, your observation about Pitta? Teenagers. So the anxiety of social pressure, peer pressure, performance anxieties all come in at that age, so teenagers. So I think parents also have to be a little more observant about the children and during their growing years to understand if it is a Pitta-related depression or the symptoms that you're watching are Pitta related. So Dr. Nair, let's get to the treatment process. How difficult, how easy, how comforting is the treatment at Santhigram when somebody with Pitta related depression comes for treatment?
See, when the mind is not working, it is like a darkness. That is called a tamas. We remove it to the rajas, we enlighten them.
Okay.
With the treatment. And then they will become sattva, then only they will be able to focus. So to remove the toxins, that is the amam, like enveloped in their brain, that has to be removed. So in these cases, that Nasyam is also given, Shirodhara is given, Abhyangam is given, and more than that, we'll be giving them very good counseling and, dietary supplements, diet and everything.
Okay.
And
but Dr. Nair, when you said teenagers, I mean, pardon my saying this, my dear viewers, also, there is an assumption that it's very difficult to get across to a teenager, to talk to them, their stubbornness or their sense of independence, because they're going through that phase that they want to be independent. So this is very challenging for you as a doctor and your team also to talk to teenagers or growing adults and make them explain that these conditions that they're going through sometimes is normal and sometimes can be treated.
It is not at all a big problem, Madhavi, because actually the way we explain, the way we make them understand where they went wrong, that correction has to be done. I always tell them, how much you help me, I will help you more so that you will be stabilized in the normal way. See, in certain cases, over-utilization of their brain, they want to do so many things in one go.
Right.
Then getting into wrong paths.
Okay.
See, the causes of impediment has to be, removed. Then only the mind will work,
Okay. So, Dr. Nair, can you please suggest us some home remedies or foods that we should eat? It's not remedies. Let me correct myself again there. Let's talk about certain foods that can help in the wholesomeness of the body, especially when a parent or anybody who is going through Pitta-related depression or they see the symptoms. What kind of foods are good for such care?
Sweet is good.
Sweet
food,
okay.
Yeah, not so much. But, we have to see that whether they're sleeping properly. That has to be observed. Whether, you have to see that whether, the child may be doing, anybody with Pitta, they used to exercise a lot. Now they don't enjoy that. So there will be a problem at that time. Closing the door and sitting for a long time. They don't want to come out. Okay, they don't want to eat in time. So making, because whoever is there, some people are staying alone, that we cannot help them. But, giving them food in time, proper sleep, this itself will make a lot of difference, And mild exercises, yoga, like over, any food, like monotonous, if you keep on eating, sometimes it will create so many amam in the body, so all the toxins will, that's why, I cannot say because people will be fighting.
Yeah, there are some underlying factors, viewers, we always mention in the program Aware and Care. Please understand, Ayurveda is a completely different science, but it talks about the root cause and it is an ancient science, 5,000 years plus old, and there's so much information also on the net. But the best way to get any information is to go and speak to an expert, talk to them. Their patience is very much important. And all the other gadgets and people that give you information, we respect that. But apart from that, when it comes to treatment like mental health, physical well-being, it is best to reach out to an expert. Dr. Nair, we spoke about Vata-related depression. We're now speaking about Pitta-related depression. What is the common point, or do you feel that somebody shifts a gear while treatment? Or you feel there is a phase when there is Pitta, then, Vata-related depression also comes? Or you want to give assurance to our viewers that wholesome
anything can be taken care actually, because the approach in Ayurveda, it is entirely different, See, we make them do, like a proper utilization of the mind, or the mental, see, whatever we think it is responsible for the normal or abnormal behavior. Okay, your mental conditions. So after the treatment and after being within Ayurveda for some time, then definitely this person will be a very, like a very normal personality. But it takes time. It's not in 3 weeks or something like that. They will be brain, like it's a brainstorming.
And friends, I do want to give out a little note there that many patients who have gone there and during the series of Aware and Care have come back smiling and feeling very happy and understanding what is wholesome living, what is actually lifestyle change. It's not about chocolates and a drink or a smoking. Their lifestyle means a lot of things included in that. And a couple of sessions with Dr. Nair, they have seen great improvement. We appreciate all those messages also that come to us. And we are so grateful that you share and endorse your experience with everybody. Dr. Nair, your final words about Pitta-related depression. Like we said, this program is about just bringing awareness first. Care is definitely taken care of at Santhigram.
Yeah. See, Pitta is related to Tejas, so that you can see the smile on the face like Madhavi smiling, and the strength of the intellect and the capacity of the mind to understand, discriminate, know the truth, everything. You should always watch a person. If your good friends are also there, you should see that if somebody is criticizing somebody a lot, so it shows that it is a Pitta imbalance.
Wow. Okay.
Yeah. So don't criticize anybody.
How beautifully said, Dr. Nair. These are small things we do not pay
jealousy,
attention to.
Especially in ladies, it is more common, but I'm telling see anybody, I'm not only, like anybody with, see, we started, because why we cannot do like this? At the back of the mind, that will be the thing. But, it's very, very common. But, if you understand there is something wrong, that is called what we are giving through the awareness, you understand?
Right.
So that then they will take care.
True.
Yeah, some imbalance which otherwise we will enjoy. Somebody's prosperity, somebody's achievement, we will be enjoying. But here we will get jealous. Means something is wrong with us, definitely.
Vasudeva Kutumbikam, that means to say we have to be happy for everybody. We have to wish the best for everybody. But if you feel that little feeling coming into you that you're not happy with somebody else's success or somebody else's growth, these are small symptoms, dear viewers. Please do not take them into personal comment there. It is just about the totality of about wellness. Please consult Dr. Ambika Nair and her team at Santhigram Group of Companies. More than that, Dr. Nair always endorses the fact, whether it's her or any other doctor, you must consult a doctor before you try any remedies at home. Do not assume that whatever is happening to you or to somebody else is something that can just be taken care of or brushed off. Thank you so much, Dr. Nair, for these episodes on Aware and Care. We are so grateful to the community that they are opening up. It has been a slow process, but we are so happy to see more and more people coming and talking about these conditions and, of course, their treatment options at Santhigram. I look forward to the next episode with you on Aware and Care. Viewers, please like, share, and subscribe to the episodes. Thank you.
Loga Samasta Sukhino Bhavantu. That's what we want.